Diabetes is a long-lasting, chronic health condition that affects mechanism of how your body turns food into energy. In the last 20 years, the number of adults diagnosed with diabetes has more than doubled. Most of the food you eat is broken down into glucose, which is sugar basically, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells for use as energy. If you have diabetes, that means your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin, or cells stop responding to insulin, too much blood sugar left unused in your bloodstream. Over time, that can cause serious health problems, such as coronary heart disease, visual impairment, and kidney disease. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is thought to be caused by an autoimmune reaction. It means your body immunity attack your own body by mistake, and your body stops making insulin. Approximately 5 to 10% of the people who have diabetes have type 1. Symptoms of type 1 diabetes often develop quickly. It's usually diagnosed in children, teens, and young adults. If you have type 1 diabetes, you'll need to take insulin daily to survive. Currently, no one knows how to prevent type 1 diabetes. While with type 2 diabetes, your body unable to utilize insulin well, and can't keep blood sugar at normal levels. About 90 to 95% of diabetic people have type 2. It develops over years and is usually diagnosed in adults. Due to current lifestyle, more and more children, teens, and young adults affected by type 2 diabetes nowadays. It is important to check your sugar regularly if you are at risk, because you may not notice any symptoms sometimes. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes. Gestational diabetes develops in pregnant women who have never had diabetes. If you have gestational diabetes, your baby could be at higher risk for health problems. Gestational diabetes usually goes away after your baby is born. However, it increases your risk for type 2 diabetes later in life. Your baby is more likely to have obesity as a child or teen, and more likely to develop type 2 diabetes later in life too. Overall, 34.2 million US adults have diabetes, and 1 in 5 of them don't know they have it. There isn't a cure yet for diabetes. But eating healthy food, losing weight, and exercising regularly can really help in better diabetic control. Taking medicine as advised, getting diabetic self-management education and support, and following health care appointments can also reduce the impact of diabetes on your life.